information. So,
welcome. This meeting, of course, is being recorded, and thank you all for joining us today for the Healthy Illinois 2028 SHIP, State Health Improvement Plan, public hearings. I'm Karen Phelan, and I'm the chair of the Illinois State Board of Health. On behalf of the State Board of Health members listed on the screen, we are excited to share the draft Healthy Illinois 2028 State Health Assessment, SHA, and State Health Improvement Plan, and hear your feedback. Our objectives today will be to share a brief summary of the State Health Assessment process and findings and the State Health Improvement Plan draft, to hear from members of the public with your feedback and comments, and to share next steps. The State Health Assessment included 4 assessment processes, and this data informed the selected priorities defined in the State Health Assessment Report. This State Health Improvement Plan includes a plan to address the priorities collectively. Together, these documents will be referred to as Healthy Illinois 2028. Our agenda and process for today is explained on this slide. All participants will remain muted until we call those to provide public comments on the SHIP. Only the first 30 members of the public who have registered will be called to present for up to 3 minutes each. Written comments may be provided also at the link provided. Please note once again that this meeting is being recorded for public viewing on the IDPH website. If you experience any technical difficulties, please message Samantha at samantha.lasky@iphiionline.org. Thank you very much. This is public comment only. I will now pass it over to Dr. Samir Vora, the Director of the Illinois Department of Public Health.
Well, thank you so much for that introduction, Chair Phelan, and for all your leadership and that of the State Board of Health as we commemorate and celebrate this important day, as we share the data and findings and solicit your feedback on a plan we have been working on with over 100 public health partners across Illinois. The Healthy Illinois 2028 State Health Improvement Plan. We're here today to get your comments and your feedback to make sure that this plan really speaks to the challenges that our state faces. As Chair Phelan mentioned, I am Samir Vora, the Director of the Illinois Department of Public Health, and it is my absolute honor and privilege to lead this incredible agency. And in addition to the many members of the public who provided input during the assessment process and the many partners and subject matter experts who contributed to this plan, you'll hear more about them shortly. I would also like to recognize and thank the staff and partners who led the process. We were so fortunate to have Jenny Epstein, our IDPH Deputy Director of the Office of Policy Planning and Statistics, lead us, and I thank her, April Koch, and other members of the staff who are closely involved in the process, and those individuals here are listed on the screen. I also want to thank our partners at the University of Illinois at Chicago School of Public Health and the Policy Practice and Prevention Resource Center, or known as P3RC, and their subcontractor, the Illinois Public Health Institute, who are helping coordinate these public comment hearing sessions. Finally, I would like to recognize the State Health Assessment and the State Health Improvement Plan Partnership, the SHA-SHIP Partnership. Appointed collaboratively by our previous IDPH Director Ngozi Ezike and Governor Pritzker for aiding in the development of the SHA and SHIP alongside IDPH and the UIC IPHI planning team. This group met monthly through 2022, moving to quarterly in 2023, and help plan the assessment activities, review the data and identify findings, select priorities based on the data, and help develop goals and objectives and identified subject matter experts to finalize the draft plan. This partnership, this SHA-SHIP partnership, will continue to monitor implementation and measurement of the work. Here are the members of the partnership. We thank them for their service, and we thank them for their leadership and commitment to the health of Illinois. So, Healthy Illinois 2028. This is our vision for what we want the state to be at and the areas where we can identify and improve to make that commitment possible, a healthier state every year as we reach Healthy Illinois 2028. The vision for Healthy Illinois 2028 is the achievement of health equity across Illinois by addressing structural and social determinants of health, those root causes, foundational items that affect health, through a unified public health system, one focused on community engagement and collaboration, a strong workforce, and sustainable and flexible local funding. The partnership also establishes these 9 fundamental principles and practices to support the advancement of the Healthy Illinois 2028 vision and guide the development of the State Health Improvement Plan goals, objectives, and strategies. As you see through these 9 objectives, we are working across silos when possible. We're using policy systems and environmental strategies for lasting impact. This work cannot be done without engaging the community throughout the process. And ultimately, we need to invest in the IDPH system, right? The Illinois Department of Public Health system that is much more than our agency. It's across government, it's across community partners to get to a place where the principles and practices before you guide the way that we implement the State Health Improvement Plan. So it is my absolute pleasure to kick us off, and now I'll turn it over to the Illinois Public Health Institute, Samantha Lasky, for an overview of the process for developing the SHA and SHIP. Thank you so much for your attendance with us here today.
Thank you so much, Dr. Vohra. I am Samantha Lasky, Program Manager with IPHI. I helped lead the SHA and SHIP process over the last few years. So going right in 2021 and 2022, there were significant updates to the SHA-SHIP law to reflect the changing public health landscape, increase focus on health equity, strengthen community engagement in the process, and to extend the timeline for completion, as seen on this slide. This slide shows the timeline from the 2021 SHIP update through the development of the SHA and the SHIP to when we plan to launch implementation of the SHIP on January 1st. The SHA-SHIP were updated in 2021 to launch the process. Beginning in 2020 with a team of partners established prior to the SHA-SHIP partnership, Illinois began a more condensed version of the process known as the Healthy Illinois 2021 update to meet the law and prepare for a comprehensive SHA-SHIP the following year. It was not a comprehensive process, due in part and a majority of because our many partners were focused on the COVID-19 pandemic. We'll dive into the Healthy Illinois 2021 update in a moment. We would like to note that this update serves as the foundation for the Healthy Illinois 2028 process and documents. Beginning in 2021, the SHA-SHIP partnership was developed to drive a comprehensive plan, and we did that through adapting the mobilizing action through planning and partnerships framework developed by NACCHO, otherwise known as the National Association of City and County Health Officials. The MAP framework was undergoing a revision process, so we used an adaptation of the previous model. There are 4 assessments that we used that we conducted, which include the Community Health Status Assessment, which provides an understanding of demographics, the health behaviors, health outcomes, and social determinant conditions of our state. This included an extensive data collection and analysis process from various forms of public health of community health surveillance. The community themes and strengths assessment, which is really a community engagement report to help us understand the perceptions of the community as it relates to assets and issues that are important to the community. The community engagement activities included 16 initial focus groups with local health departments and social services providers, as well as people with lived experience. We also did additional 5 focus groups that were completed with people with lived experience to share data from the report and give feedback on the proposed priorities. The Forces of Change assessment, which identifies forces that may affect the health of the community and/or the public health system, and the threats and opportunities associated with those forces. The FOCA assessment was completed during partnership meetings with guest speakers that spoke to current or likely forces of change, as well as group discussions identifying opportunities and threats associated with those, and other forces of change to identify themes in the public health landscape. And finally, the public health system assessment. For this assessment, we looked at the capacity and capabilities of the system to deliver the 10 essential public health services while centering health equity. As NACCHO was in the process of developing an updated MAP handbook, as I previously noted, the SHASHA planning team and partnership worked together to adapt the assessment to be known as the Health Equity Capacity Assessment. The Health Equity Capacity Assessment was conducted virtually over a half day with over 85 public health system partners. We worked with the partnership to develop findings from each of the assessments and identify themes across multiple assessments. The themes were synthesized to define the priorities emerging from the data. As previously mentioned, the SHAW SHIP update produced an interim Healthy Illinois SHIP 2021 SHIP update to serve as the guidance until the new SHAW SHIP could take its place. The updated data for this SHIP update found that access to care, chronic disease, and mental and behavioral health, which were the 3 priority issues from the previous SHIP, Healthy Illinois 2021, remained high priorities, and several new priority issues were identified, including structural racism, public health system capacity and infrastructure, health equity, and COVID-19, as highlighted on this slide. These priorities laid the groundwork for identifying the main topics for this state health improvement plan, Healthy Illinois 2028. Now, I'm going to transition the presentation to my colleagues, Lori Call and Janice Goff, to dig into the findings related to the priority areas now.
Thanks so much, Samantha. Building from the interim SHIP update and the data from the state health assessment that Samantha just described, the partnership worked to refine the priority areas for Healthy Illinois 2028. The partnership identified these items as the 5 priorities for the public health system to focus on over the next 5 years. Racism as a public health crisis, chronic disease, COVID-19 and other emerging diseases, maternal and infant health, and mental health and substance use disorder. Several items also came up as cross-cutting issues or priority areas that cut across all of these areas. The cross-cutting priorities include access to healthcare and wraparound services, the physical and built environment, public health system infrastructure, racial equity, sorry about that, racial equity, lost my place here. Sorry about that. Racial equity and social and structural determinants of health, such as housing, education, access to food, and transportation. The state health assessment document provides a detailed explanation of all of the priorities based on data points. And if you were not able to view those documents, we can put a link to the state health assessment and the state health improvement plan in the chat, so you'll have those. So the first priority that we're going to take a look at is racism as a public health crisis. And this new priority is for our state to declare racism as a public health crisis in Illinois. 8 entities in the state have already issued a formal declaration, and 6 other states have done so as well. As we've seen, health disparities by race and ethnicity persist across health outcomes, income levels, and geographic spread. So racial equity is highlighted in this SHAW and SHIP as both a cross-cutting issue to weave into all priorities, as well as a standalone priority. Black and African American people in Illinois continue to have the lowest life expectancy at birth and experience higher mortality rates from heart disease, cancers, diabetes, and COVID-19. Communities of color are also more likely to experience disproportionate impacts of environmental hazards, such as living near high polluting industries, lower access to green space and parks, higher urban heat island effect because of lower tree counts in their neighborhoods, living near polluted waterways, and are more likely to live in neighborhoods that still have lead service lines. This phenomenon is called environmental racism, and this priority also addresses environmental racism. People of color are also more likely to experience discrimination by healthcare providers, so increasing representation and cultural and linguistic competence in the public health workforce is vital. We'll move on to our next priority now, chronic disease. Chronic disease is a priority that carried over from Healthy Illinois 2021. It's defined as conditions lasting 1 year or more that require ongoing medical attention, limit daily activities, or both. More than half of Illinois residents live with a chronic condition. Heart disease and diabetes are the leading causes of death in the state, and nearly 1/3 of Illinoisans have high blood pressure and high cholesterol. And there are very clear ways we can reduce these numbers through improving access to resources for prevention and chronic disease management. Access to care for preventative and disease management was one of the primary concerns. Oral health also emerged as a prominent issue in the state for similar reasons. The third priority is COVID-19 and emerging disease. COVID-19 is a new priority for many reasons, but particularly as a catalyst for change in the public health system itself. COVID-19 was a leading cause of death in 2020, with extreme disparities across racial and ethnic groups. Many of the important takeaways from the pandemic highlighted work that needs to be done in the public health system to be able to respond better to future threats. We know that as climate change is expected to worsen, this will have many health consequences, including exacerbating and increasing the prevalence of chronic conditions, cardiorespiratory illness, and vector-borne diseases. COVID also highlighted many public health system failings, including workforce challenges, communication gaps, lack of public trust, and inefficient data systems. With that, I will turn it over to my colleague, Janice Goff, to finish up reviewing the priorities.
Thank you so much, Lori. Our next priority is maternal and infant health. Maternal and infant health is a continued priority from the Healthy Illinois 2021 State Health Improvement Plan, as statewide infant mortality remains higher than the Healthy People 2030 benchmark and has extreme disparities by race and ethnicity. The rate of infant mortality is twice as high for Black and African Americans than the overall rate for the state. The focus of maternal and infant health in this State Health Improvement Plan is on improving access to health care and delivering quality public health services for reproductive and infant health. Access to the full range of reproductive health care services and education, prenatal care, oral health, and maternal mental health were highlighted as key issues in this priority. Racism and discrimination are also key issues in this priority because of the stark disparities in health outcomes related to maternal and infant health. Our next priority is mental health and substance use disorder. Mental health is a priority that carries from the last State Health Improvement Plan as well, and is defined here as a state of mental well-being that enables people to cope with the stresses of life, to realize their abilities, to learn well and work well, and to contribute to their communities. We know that the pandemic worsened mental health across the board, but it is particularly important for youth, LGBTQIA+ populations, and communities of color as priority populations. Among the pressing issues in mental health, access to care, stigma, and discrimination from healthcare providers were highlighted as barriers to health. Substance use disorder, or the recurrent use of alcohol and/or drugs, which causes significant impairment to daily living, is another emerging priority area alongside mental health. Mortality rates from drug overdose and opioid overdose have increased across the state, with the highest rates seen in 2020. The emerging needs for addressing mental health and substance use disorder that came out in the state health assessment were expanding youth mental health supports, strengthening the mental health and substance use disorder workforce, and expanding and improving culturally inclusive practice for healthcare providers. As Lori mentioned earlier in her presentation, in addition to the 5 priorities, the state health assessment revealed cross-cutting issues. The cross-cutting issues fall into 2 categories: structural themes related to the broader society, and themes that fall into public health infrastructure, which you will see on the next slide. The structural themes that emerged are access to healthcare and wraparound services, physical and built environment, social and structural determinants of health, and structural racism and health equity. These are factors that determine health outcomes across the 5 priority areas, and as such, each priority addresses these items in the State Health Improvement Plan. Access to healthcare and wraparound services has profound impacts across the state. It is particularly crucial in rural areas and for trans health and LGBTQIA+ populations. It includes both geographic and physical access to care providers, as well as reducing cost barriers, reducing stigma, and increasing access to culturally and linguistically representative providers across the state. The physical and built environment encompasses everything about where we live day to day. Social and structural determinants like housing, transportation, social economic status, environment, education, and community safety are all important intersecting issues when it comes to addressing health and health equity. As mentioned before, racism is both a cross-cutting issue and a standalone priority because it is at the root of many, if not all, health issues and disparities. The second theme, public health system infrastructure, it is the second theme, and it can be sorted into 4 main categories: workforce, data use improvements, system coordination and collaboration, and funding. Workforce development and capacity. Particularly since the pandemic, system-wide staffing shortages and staff burnout in the public health field have been an increasing challenge, and the system has struggled to keep up. Having a public health workforce that is representative of the community was highlighted as a need, particularly for people of color and LGBTQIA+ populations. And an adequate compensation for this workforce to maintain staff is essential. Data use improvements include evaluating current data systems for effectiveness and efficiency, modernizing these systems. Other improvements include improving access to data. For example, consolidating electronic health record systems for providers and/or effectively sharing publicly available data resources. There is also a need to shift data collection practices so that we are collecting accurate and specific data, particularly for racial ethnic categories and sexual orientation and gender identity categories. Funding for these improvements is also important. Both funding and communications across the public health system need to be de-siloed, meaning that public health entities need to be able to communicate and coordinate messaging, programs, and work streams so that they are not redundant and can address public health needs in a coordinated response. Finally, funding needs to be sustainable and flexible to adapt the shifting needs of the public health system. This concludes the summary of the State Health Assessment findings. And now we will move into the State Health Improvement Plan, which shows how the state of Illinois public health system plans to address the need of these priority areas. I will turn things over to Jenny Epstein.
Apologies, I was muted. Thanks, Janice. I will be presenting on the next several slides on the SHIP. As we said earlier, these are the 5 priorities, and listed here are the cross-cutting issues that are woven into the goals, objectives, and recommended strategies of each of these priorities. The planning team worked with subject matter experts in each of the 5 priority areas to develop the goals, objectives, and recommended strategies that are listed in the SHIP through a series of workshops over the first half of 2023. These plans are aligned with existing work in their respective fields and with other plans across the state. Starting with racism as a public health crisis, I will go over the goals that were developed in this priority and then review the objectives and a sample of the recommended strategies that were developed to address this priority. 3 goals were established for this priority and focus on capacity building for the public health system to do this work, including how to dismantle oppressive systems, developing and maintaining a diverse and skilled workforce for anti-racist public health, and finally, addressing the practices that perpetuate environmental racism. Each of these 3 broad overarching goals have objectives that further define and focus our proposed work. We will review the objectives for each goal next. The first objective is to formally declare racism as a public health crisis in Illinois, like many other cities, states, and jurisdictions have. This will elevate racial equity as a priority for our state with an advisory committee and plan to operationalize it. The other objectives are focused on infrastructure, ensuring there are resources to do the work, capacity building for the public health system to authentically engage and power share with the community, and finally, to build the state's data capacity to better understand and address needs. With these objectives, we want to ensure that the public health workforce and leadership across the state is representative of the diversity of our state, and that we have policies and the infrastructure to support this work. With this goal, focusing on advancing environmental justice, we want to reduce and prevent environmental hazards, build our state's capacity to map, track, and assess environmental inequities, and plan for addressing them, and increase investment in both the natural and built environment, specifically in Black, Indigenous communities, and communities of color. Subject matter experts from across the state work to make recommendations on strategies that will help advance these goals and objectives. Each objective has a full set of recommended strategies. All the recommended strategies are listed in the appendix of this SHIP report. For racism as a public health crisis, there are over 60 strategies. Here are just a few examples. Strategies range from state level policy, so big P policy to small p policy, using a health in all policies approach to ensure our policies don't have unintended negative consequences. We also have strategies focusing on building the public health infrastructure through training and pipeline programs to increase the BIPOC workforce. And we have strategies to address climate change impacts and to conduct health impact assessments and cumulative impact assessments related to permits impacting air, water, and land pollution in environmental justice communities. Next up, we will talk about chronic disease. 4 goals were developed for addressing chronic disease through decreasing tobacco usage, prevention of disease through nutrition, prevention through active living, and building capacity for disease management. Each of these goals has objectives and strategies to support their purpose, which I will go through next. We hope to increase tobacco-free living by reducing the number of people using all types of tobacco products, enhancing public health infrastructure to prevent tobacco usage, and reducing secondhand smoke in cars, housing, and other places where people are regularly. In goal 2, we focus on access to nutritious foods. With this goal, we want to encourage businesses to implement healthy food policies, strengthen nutrition assistance programs like SNAP and WIC, and increase education and awareness, and make sure messaging is culturally competent and realistic for people to achieve in their current lifestyle and location. This goal focuses on active living. We want to address active living in schools and workplaces through policy and program changes. We want to improve the built environment to create more safe and accessible spaces in priority communities. And we want the public health system to work across other sectors to promote active living. Finally, goal 4 focuses on strengthening communities' ability to prevent and manage chronic disease at the local level. This includes having more community health workers, improving data systems and practices, more programs for prevention and disease management geared towards specific populations, reducing cost barriers, and expanding screening and assessment processes to have better strategies to prevent and manage chronic disease. Again, subject matter experts from across the state work to develop a list of strategy recommendations for each objective to support the 4 broad goals. The list for chronic disease included over 100 strategies, which cover many topics from targeting system barriers and accessing services to support tobacco-free living, to cross-cultural partnerships with state partners like the Illinois Environmental Protection Agency and the Illinois Department of Transportation to apply a health and all policies approach to built environment and development decisions. Some strategies also focused on the public health system itself and developing a public oversight body to oversee the spending of wellness fund resources, developing policies and programs to eliminate racial disparities, and to improve data collection for underrepresented populations to better understand the health status and needs of these populations. Next, we will move to COVID-19 and emerging diseases. There are 3 goals for this priority. Goal 1, decrease health disparities related to COVID and other emerging diseases. Goal 2, strengthening community resilience to emerging health threats. And Goal 3, improving public health infrastructure to respond to and to prepare for these new threats. The first goal focuses on health disparities. We want to improve equitable access to vaccination, testing, and treatment, improve public health in the public health system, increase vaccination and testing in under-resourced communities, and improve dissemination of vaccines in congregate settings and with homebound individuals. Goal 2 focuses on community resilience by building trust between communities and their health departments, improving access to resources related to the relevant emerging disease for priority communities, and improving both indoor and outdoor environmental conditions to reduce transmission and vulnerability. This final goal focuses on the lessons learned from the COVID-19 pandemic and improving public health infrastructure to prepare for and respond to emerging threats. This includes having timely partner field-informed communications plan, coordinating emergency preparedness and response activities across the public health system at all levels, improving data sharing systems, and improving the public health system's resource capabilities to be more efficient and effective. The strategies developed for these 3 goals mainly reflect the lessons learned from the COVID-19 pandemic and Mpox outbreaks. So the subject matter experts that convened on this priority focused mainly on infrastructure improvements. Some examples include developing data dashboards and detailing emergency worker responsibilities for IDPH staff to improve responsiveness. Improving public trust in the public health system is also a priority. So working with community leaders to disseminate information and engage in awareness trainings, as well as establishing an equity team to improve outreach to priority populations are some of the recommendations. Next, we will move to maternal and infant health. There are four goals for the maternal and infant health priority. Goal 1, improving access to and quality of equitable reproductive health care services. Goal 2, improving systems of care and support services for all birthing persons. Goal 3, improving systems of care for better birth outcomes and infants' healthy development. And Goal 4, addressing mental health and substance use disorders among pregnant postpartum individuals. The first goal focuses on reproductive health care by increasing availability and quality of preventative medical visits with sexual and reproductive health screenings and increasing access to a full range of reproductive health services. Goal 2 focuses on support for birthing persons through improving access to and quality of prenatal and postpartum care and services, improving maternal morbidity and mortality outcomes in hospital settings, and addressing social and structural determinants and barriers to care for pregnant and postpartum persons. This goal focuses on infant health outcomes by improving access to, quality of, and coordination of services across the perinatal continuum and addressing social and structural determinants of health for infants. And the fourth goal here focuses on mental health for pregnant and postpartum individuals. We want to address substance use disorder to reduce the rate of neonatal abstinence syndrome and pregnancy-related mortality. And we want to reduce postpartum depression and pregnancy-related mortality from mental health. These strategy recommendations have an emphasis on equity, particularly in addressing maternal and infant mortality disparities across racial and ethnic groups and access across the full continuum of healthcare services. Some examples of recommendations include developing in-school clinics in high-risk areas, increasing availability and quality of mental health and substance use disorder services for pregnant and postpartum individuals, as well as piloting an income supplementation program. Other strategies highlight the work of the Illinois Task Force on Infant Maternal Mortality among African Americans to decrease disparities in this population. For the final priority, we will move on to mental health and substance use disorder. This priority has 4 goals that focus on improving community capacity for mental health and substance use disorder support, as well as public health system infrastructure. These goals include 1, improving the public health system's ability to prevent and treat mental health and substance use disorder. 2, developing and implementing harm reduction and preventative care services. 3, reducing institutionalization and incarceration by strengthening community-based care. And 4, improving community resiliency and recovery capital in response to violence. The first goal focuses on infrastructure by improving data capacity, increasing the system's ability to address behavioral health more effectively, integrating mental health and substance use disorder care with other healthcare services, and increasing funding for these improvements. Goal 2 is intended to reduce mental health and substance use disorder mortality through harm reduction and preventative care. In alignment with the State Overdose Action Plan, we want to improve age-adjusted suicide rates, improve mental health in children, adolescents, and young adults, and improve morbidity and mortality of substance use. We also want to improve prevention and linkage to care. Goal 3 aims to reduce mental health and substance use disorder related to institutionalization and incarceration. We want to narrow the treatment gap through community-based treatment and increase access to services, particularly for communities with disproportionate rates of incarceration and populations that have lower access to mental health services. The last goal focuses on community violence. To advance this goal, we want to increase mental health and substance use disorder services in communities with high rates of violence and prevent and address adverse childhood experiences, or ACEs. To do this, we also want to improve data collection related to community violence and develop tools and resources to better respond and prevent community violence. The subject matter experts recommended over 80 strategies. Many of the recommendations focus on harm reduction and prevention strategies and community-based support. These strategies cover a wide range of areas, including improving data infrastructure, strengthening public health workforce capacity, and developing crisis response teams. Some prevention and harm reduction tactics include incentives, trainings, and policies to improve providers' ability to treat substance use disorder as a part of their regular medical care, as well as increasing screening for substance use disorder and access to medication-assisted recovery for those who are or have been involved in the criminal legal system. This concludes the SHIP summary. We will now move into the public comment period.
Thank you, Jenny. Hello, everyone. So we are now in the public comment period, and we have some instructions here for folks. Speakers will have 3 minutes each. Please be mindful of time so that we hear from as many people as possible. Those folks who are speaking were the first 30 who are registered, and we have a full total of 90 minutes for speakers, which is why we have 30 total speakers. When it is your turn to speak, I will call your name and unmute your mic to allow you to share your comment. Only the current speaker will be unmuted. On the screen here, you'll see a note that says, a screenshot that says the host would like you to speak. That will pop up when it is your time when I unmute you. And you make sure to click the unmute button first. Please be sure you have the chat button open, as Adrian will be using the chat to let you know when you are next in line to speak and to give speakers a 1-minute warning as well. As a reminder, members of the press in attendance today are not permitted to speak. And finally, if you are not going to provide a formal speaking comment, please, we invite you to use the Google form, which will be dropped into the chat, to submit a written comment as well. We may have time for additional folks to speak up at the end. In that case, once we announce that, please message me in the chat. So, as it is time for comments, I will go ahead and stop sharing and start listing the folks who will be speaking. The first individual on our list is Rawan Al-Khatib, and I apologize if I'm mispronouncing names, but I do not see this person on the list. If you are here and I do not see your name, please chat us. The next person is Gloria E. Barrera. I do not see Gloria on the list either. And the third person we have on the list is Liz Fisher. Again, if you are calling in on a phone or anything like that, please, I see one person call in. Please email me if that is the case, or if your name is not listed. And I will be also paying attention to my emails. The next person is Mahima Dave. It is now your turn to speak.
Hi, everyone. My name is Mahima Dave. I have a bachelor's degree in public health and am local to the Chicagoland area. Super excited to learn more about this initiative and contribute. I appreciate how the structure of this plan takes place as such, where there's a goal followed by objectives. However, I would suggest that we make this accessible to the community by providing insight as to what this plan is for them. So in the introduction of this plan, perhaps we can have a paragraph or a short synopsis as to what the impact of this will be. So whether it's a healthcare provider, a public health practitioner, student, or a individual who's wanting to learn more about their health, they can become knowledgeable as to what the Illinois Department of Health has in mind to safeguard their health at a community level. Furthermore, for the goal focusing on maternal and child health, especially looking at postpartum health, I believe that it would be important to modify the final goal to include culture competency, recognizing that our cultures and our beliefs contribute to the stigmas that we have about seeking mental health support in postpartum care. It would be important to perhaps subtly introduce cultural competency in terms of postpartum care. Other than that, I believe that the plan is sufficient in addressing the pressing public health issues, and I look forward to utilizing this as a resource for implementation and development of many more public health projects.
Thank you so much, Mahima. The next person on the list, it doesn't look like they are here, but I will say their name regardless, is Caroline Antler. And following that is Brenda Alwert, and I will unmute you now.
Hello.
It looks like you have some feedback there, Brenda.
I don't have anything on. I'm sorry.
Okay, thank you, Brenda. The next person on our list is Jessica Harris.
Hello. Can you hear me?
Yep.
Okay. Thank you for your time today. In May of 2020, my mother, Tanya Noren, we were from Casey, Illinois. She was diagnosed with ALS at the SIU School of Medicine in Springfield, Illinois. In June of 2020, we took her to Mayo Clinic in Minnesota for a second opinion, and they also diagnosed her with ALS, this time with a dirty EMG. She was given 3 to 5 years to live. In February 2021, my mother returned to her neurologist and was told she was entering the middle stages of ALS. By this time, her hands were forming into claws. She was losing muscle, specifically between her pointer finger and her thumb, and her lungs were only functioning at 34%. In March of 2021, we took my mom to see a Lyme literate medical doctor. This doctor did not follow IDSA guidelines for tick-borne infection. This doctor follows ILADS guidelines for tick-borne infections. And this doctor gave my mom an IGeneX test. In April of 2021, we discovered that my mom was actually positive for many tick-borne infections, according to the IGeneX test. I would like to note that my mom was tested for Lyme disease at Mayo Clinic and was told that she was negative. Upon further research, we discovered that about the standard testing in the United States for tick-borne infection is giving over a 50% false negative. In other words, 50% of people that actually have tick-borne infections are being told that they do not. In April of 2021, my mother started treatment for the infections that the IGeneX test pinpointed, and all progression stopped. Not only did my mom's progression stop, my mom has improved with tick-borne infections following ILADS guidelines. Today, my mom is around 85% improved. She's able to live life completely unassisted, and she works 40 hours a week. She is in better health today at 3.5 years into her ALS diagnosis from when they diagnosed her with ALS. However, if we stop the treatment for tick-borne infections, her ALS symptoms return. Upon finding my mom had these infections, I started a group on Facebook called When ALS/MS/TM is Lyme. And that group has really taken off. In just a few short years, it's grown to over 3,000 people. And there's an entire community of people finding that they actually have tick-borne infections. Others from Illinois, even, that have been diagnosed with ALS, they are finding ILADS trained physicians, and they are improving as well. I know that I'm running short on time, so I just want to say that these infections are being passed from mother to child. With proper testing, I have found that I have these infections, as do my 3 children. There is only one doctor in the entire state that takes insurance.
I believe the 3 minutes included.
Samantha, we talked about, because we had so few people sign up, we can be you can allow a couple more minutes.
Okay, Jessica, we're gonna unmute you again.
The last thing we heard, Jessica, was that it was being passed from mother to child.
Yes, they're being passed from mother to child. I have these infections, as do my 3 children. There's only one doctor in the entire state of Illinois that takes insurance that understands that these infections are turning chronic. But all 3 of my children, as well as myself, were tested with the Western blot, and we were all told that we were negative. However, with accurate testing, we all have multiple infections. We need help. My children got COVID in September of 2022, and their Lyme symptoms exploded. severe neurological issues, severe GI issues, severe anxiety, depression. It was horrible. Our lives depend on people becoming Lyme literate. Our lives depend on doctors. In the state of Illinois, there was a law passed called the Lauren Russell Lyme Disease Prevention and Protection Law. This law protects doctors in the state of Illinois from losing their license because the CDC does not recognize that these infections are turning chronic. This law also enforces insurance to cover correct testing and treatment for these infections. We need help.
Thank you.
Thank you, Jessica. Okay, the next person on our list is Dr. Patrina Jackson. Dr. Jackson, feel free to unmute. Dr. Jackson, if you're speaking, we can't hear you. Okay, thank you. Dr. Jackson said they're unable to speak right now. Feel free to jump in. Okay, the next person, or actually, I believe that it was everyone on our list. If you came on earlier and did not sign up in the first 30 but would like to speak, feel free to message us in the chat to let us know that you would like to speak. And we will go in order of who messaged us first. Hi, everyone. It looks like we don't have any additional written comments or in people asking to speak up. We will be on the line until if somebody does. Otherwise, if you'd like to provide a written comment, you can do that as well. Just know that we will be here waiting for folks to provide a public comment if they so choose. Oh, and I see actually a hand raised from Amy, Amy O'Rourke. Go ahead.
I just have a quick question, and I may have missed this. I see the link for the comments. Would you be able to provide a link to the document? I'm not finding that in any of the materials.
To the Shaw SHIP document?
Yes,
Okay, yeah, we'll
Thank
post
you.
those again.
thank you again.
Karen, do you want to share your
Thank you, Lori.
closing comments?
Thank you. Thank you for sharing your feedback today. We again will be here until 4 p.m., but I wanted to quickly go through the next steps in the process. We will be reviewing everything we heard from you all today and in the other hearings to take into consideration as we finalize the SHIP. We appreciate you all joining us today and sharing your voice on the matter of health improvement in Illinois. For those of you who are unable to speak today, you may submit written comment via the Google form link in the chat. Comments must be submitted by 5 p.m. Thursday, November 30th. The SHIP document will be finalized and presented to the General Assembly per the law. Comments from these hearings will also be shared with the action teams as they launch in January 2024 to develop and implement detailed implementation plans. Thanks to all of you once again for your interest in the State Health Improvement Plan, and a special thanks to the staff at IDPH and IPHI who presented here today. And again, we will stay on until 4 as mandated by law.
Karen, we have a question about when this will be presented to the General Assembly. Are we able to answer that
We will submit it by year's end. And
per
it,
the law? Mhm.
and it will be based on their schedule.
Jenny and Karen, there was a question in the chat. And there will be 2 additional public hearings, one tomorrow from 1 p.m. to 4 p.m. and one Thursday from 1 p.m. to 4 p.m. But there were a couple of other.
Adrian, will you repost the links and just note what that link is for? I think people are seeing the link and don't necessarily know.
If anyone new has gotten on the call, we are currently in the public comment period. If you would like to make a public comment, please message us in the chat to let us know.
Erin, you may provide oral public comment that's open right now. And if you would like to share, Samantha can unmute your line.
Okay, Erin.
Hi, good morning. Thank you, Lori. I appreciate that. And thank you, Samantha, for unmuting me there. My name is Erin Fogarty. I'm with the Livingston County Health Department. I'm our Health Education and Marketing Director. I just want to say thank you for allowing me to share my thoughts on this matter. In reviewing Healthy Illinois 2028. Some areas that I would just like to bring attention to on behalf of our residents here in Livingston County. One in particular is the lack of access to maternal and child health, particularly prenatal care. Here in Livingston County, we're the 4th largest geographical county in Illinois, and we currently have no labor and delivery available here in Livingston County. So with that said, it's having a huge impact on our region as a whole, because now we have a number of our residents that are seeking that care outside of our county, which is over inundating those services that are available in some of the neighboring counties. It also poses a huge barrier for our residents, as transportation is oftentimes one of the largest barriers that we have here in Livingston County. So not being able to have access to prenatal care and not having any of those services available, we're starting to see huge impacts here, not just for our residents, but the clients that we see here at Livingston County Health Department. I also wanted to kind of piggyback and second the line in there that made note that oral health services are particularly challenging for rural communities. Here in Livingston County, again, 4th largest geographical county in Illinois, and we have no Medicaid oral health providers. It's something that we're currently working on, but again, it poses huge transportation barriers. And again, we're over inundating our neighboring counties because those are the only services that we're able to refer individuals to. And for a number of those people, it often takes upwards of 6 months, sometimes even longer, to be seen by anyone for oral health care, if they're even able to get those services based off of their Medicaid status. So trying to figure out ways, and that's one thing that we're working on here at the health department, is reaching out to our county oral health providers and seeing what we can do to help encourage them to participate in the Medicaid process. But we're running up against some barriers with that there. So just some further guidance and discussion on how to help assist rural communities in accessing oral health care. And then lastly, on behalf of Livingston County, just a real focus on that transportation need there. Again, we have a number of not just our prenatal care, our labor and delivery closing. It's just becoming increasingly harder for our residents here to maintain any sort of a relationship with their healthcare providers. We consistently hear over and over again that, once they finally get hooked up with a new primary care provider, that person leaves within a year, and they're not really able to maintain and establish a relationship with those individuals. And as a result, they often don't maintain the care that they're needing in that. So trying to figure out a way so that we can have longer standing relationships with healthcare providers would be a welcome change around here as well.
Thank you, Erin.
Thank you all. I appreciate the time. Thank you.
Thank you. Again, if anybody would like to speak during this public comment period, please message the hosts and panelists to let us know you would like to speak. For those who may have just gotten on the call, we are currently in the public comment period. If you would like to provide a public comment, please feel free to drop a message to us in the chat to let us know that you'd like to speak up, and we will go ahead and unmute you. Thank you so much. For those of you who may be just getting on, we're currently in the public comment period. If you would like to provide a public comment, please message us in the chat, the hosts and the panelists, and let us know that you would like to speak up, and we will go ahead and unmute you. For more information, we have just dropped a bunch of links in the chat to our written comment form if you'd like to provide a written comment, the reports that are currently posted publicly, and the registration for the sessions for tomorrow and Thursday. Thank you. All of the public hearing sessions will provide the same information about the state health assessment and state health improvement plan, also known as Healthy Illinois 2028, with the same content information and a public hearing comment portion, similar to what we are doing right now. So each session will be the exact same. Hi, everyone. For those of you who may have just gotten on the call, we are currently in the public hearing or the public comment portion of the public hearings. If you would like to provide a public comment, please drop in the chat, message us and tell us that you would like to speak up, and we will go ahead and unmute you. Otherwise, we are waiting for folks. We'll be on the line until 4 p.m. And there are some links in the chat for those of you who would like to submit a public comment through a written form, where the reports are available, and to register for tomorrow's session. Thank you. Hello, for those of you who may have just gotten on, we are in the public comment period of the public hearings. If you would like to provide a public comment, please message us in the chat and we will unmute you for your 3-minute public comment. If you would like to provide a written comment, we will drop that link in the chat, as well as the available reports and registration for tomorrow's session if you'd like to see from the beginning. All information will be the same over the next 3 days with the exception of public comment. Thank you. Oh, I would like to add, otherwise either way, we will be staying on the line until 4 p.m. Hi, Simon. Would you like to do a oral comment? If not, feel free to drop that information in our public comment written form, and I'll drop that in the chat again. But comment in the chat if you'd like to unmute. For those of you who may have just gotten on, we are in the public comment portion of our public hearing. If you would like to speak, feel free to drop in the chat and let us know you would like us to unmute you and speak. We will be on here until 4 p.m. for those who would like to speak up. We also have I dropped in the chat a form to submit comments written if you would not like to speak up today. Reports, our state health assessment, state health improvement plan reports, which are available on the website, and registration for tomorrow's session to hear more information about this if you did not hear it today. Thank you. Hello, all. For those of you who have just joined us, we are currently in the public comment period of the public hearings for the state health assessment, state health improvement plan, also known as Healthy Illinois 2028. If you would like to provide a public comment orally, please feel free to message us and we will unmute you for your 3 minutes. If not, we also have links to the reports, to register for tomorrow's session, and to submit a written comment. If we will be hosting these public hearing sessions tomorrow and Thursday as well at the same time, so feel free to register for those and check us back tomorrow. We'll be here until 4 p.m. This meeting is from 1 to 4 p.m. today, tomorrow, and Thursday. For the rest of the time today, we will be waiting for folks to provide public comment. Thank you. For those of you who may have just joined us, this is the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. We are currently in the public hearing, the public comment process. So if you'd like to provide a public comment, please feel free to message us in the chat to let us know that you would like to speak, and we will go ahead and unmute you for 3 minutes. If you would like to provide a written comment, we have a written comment form available to everybody, as well as links to the reports if you would like to review those as well. And if you missed the earlier part of today's presentation or would like to register to hear more about these items tomorrow or Thursday, please feel free to register with that link. Those hearings will also be from 1 p.m. to 4 p.m. and you can provide a public comment that tomorrow or Thursday as well. And For those of you who have just joined, we are in the public comment portion of the public hearing for the state health assessment and state health improvement plan, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link. In the chat, we will also have a link to the reports as well as a link to register for tomorrow's sessions. Tomorrow's session and Thursday's session. If you missed today's presentation, please note that all 3 public hearing presentations will be the same. They will all be from 1 p.m. to 4 p.m. We will stay on until 4 p.m. today to allow for public comment. Thank you. For those of us who just joined, we are in the public comment portion of the public hearing for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you'd like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link as well. We also have a link to the reports as well as a link to register for tomorrow's session if you missed today's presentation. Please note that all 3 public hearing presentations are the same. We also have a session on Thursday. All sessions will be from 1 p.m. to 4 p.m. We'll stay on today until 4 p.m. to allow for public comment. Thank you. For those of you who just joined, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link. We also have a link to the reports as well as a link to register for tomorrow's session and Thursday's session if you missed today's presentation. Please note that all 3 public hearing presentations are the same. All 3 sessions are from 1 p.m. to 4 p.m. and we will stay on until 1 p.m. today to allow for public comment. Thank you. For those of you who have just joined, we are in the public comment portion of the public hearing for the State Health Assessment and State Health Improvement Plan, also known as Healthy Illinois 2028. If you'd like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you'd like to provide a written comment, see the chat for the link. We also have a link to the reports as well as a link to register for tomorrow's session and Thursday's session if you missed today's presentation. Please note all 3 public hearing presentations are the same. All sessions are from 1 p.m. to 4 p.m. and we will stay on until 4 p.m. today to allow for public comment. Thank you. For those of you who have just joined, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you'd like to provide a written comment, please see the chat for the link. We also have a link to the reports as well as a link to register for tomorrow's session and Thursday's session if you missed today's presentation. Please note all 3 public hearing presentations are the same and all sessions are from 1 p.m. to 4 p.m. We will stay on until 4 p.m. today to allow for public comment. For those of you who've just joined, we are in the public comment portion of the public hearing for the State Health Assessment, State Health Improvement Plan, also known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we'll unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link. We also have a link to the reports as well as a link to the registration for tomorrow's session and Thursday's session. If you missed today's presentation, please note that all 3 public hearing presentations are the same. Our sessions over these 3 days will be from 1 p.m. to 4 p.m. We will stay on until 4 p.m. today to allow for public comment. Thank you. For those of you who have just joined, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you'd like to provide a public comment, please message us in the chat. We will unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link. We also have a link to the reports as well as a link to register for the next 2 sessions, today, tomorrow and Thursday. If you missed today's presentation, please note that all 3 public hearing presentations are the same. We will, tomorrow's session as well as Thursday's session are all from 1 to 4 p.m. We will stay on till 4 p.m. today to allow for public comment. Thank you so much. For those of you who just joined, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan known as Healthy Illinois 2028. If you'd like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you'd like to provide a written comment, please see the chat for the link. We also have a link to the reports as well as a link to register for tomorrow's and Thursday's sessions if you missed the presentation today. Please note, all 3 public hearing presentations are the same. We will stay on until 4 p.m. today to allow for public comment, and the rest of the sessions will also be from 1 to 4 p.m. Thank you. For those of you who just joined us, we are in the public comment portion of the public hearing for the State Health Assessment and the State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you'd like to provide a public comment, please message us in the chat. We will email you. Nope, we will unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link. We also have a link to the reports as well as a link to register for tomorrow's session and Thursday's session if you missed the presentation today. Please note all 3 public hearing presentations are the same. Tomorrow's session and Thursday's session will be from 1 p.m. to 4 p.m. We will stay on until 4 p.m. today to allow for public comment. Thank you. For those of you who have just joined, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link. We also have a link to the reports as well as a link to register for tomorrow's session as well as Thursday's session if you missed today's presentation. Please note that all 3 public hearing presentations are the same. All the sessions will be from 1 p.m. to 4 p.m. We will stay on until 4 p.m. today to allow for public comment. For those of you who have just joined, we are in the public comment portion of the public hearings for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat and we will unmute you for 3 minutes. If you would like to provide a written comment, see the chat for the link. And we also have a link to the reports as well as a link to register for the next 2 sessions tomorrow and Thursday. If you missed today's presentation, please know all 3 public hearing presentations are the same. All 3 sessions are from 1 p.m. to 4 p.m. and we will stay on till 4 p.m. today to allow for public comment. That is the next 8 minutes. Thank you. Hello, everyone. We are in the last 5 minutes of the public comment portion for the public hearing for the State Health Assessment and State Health Improvement Plan, otherwise known as Healthy Illinois 2028. If you would like to provide a public comment, please message us in the chat. We will unmute you for the next 3 minutes. If you would like to provide a written comment, see the chat for the link. We also have a link to the reports as well as a link to register for tomorrow's session and Thursday's session if you missed the presentation today. Please know all 3 public hearing presentations are the same. All 3 sessions are from 1 p.m. to 4 p.m. and we will stay on until 4 p.m. today to allow for public comment. Thank you for being here, lovely people, and staying with us till the end.
Thank you all for staying with us through public comment. I'll quickly go through the next steps in the process. We will be reviewing everything we've heard today, as well as for the next 2 days, to take into consideration as we finalize the SHIP. We appreciate you all joining us today and sharing your voice on the matter of health improvement in Illinois. Comments must be submitted by 5 p.m. Thursday, November 30th, if you were going to do a written comment. The SHIP document will be finalized and presented to the General Assembly per law. Comments from these hearings will also be shared with the action teams as they launch in January 2024 to develop and implement detailed implementation plans. Thanks to all of you again for being with us and taking an interest in the State Health Improvement Plan. A special thank you to IDPH staff and all IPHI staff as well today. It was a long day, I know. This concludes today's public hearing. Thank you.